Hello, this is Smita Kumar, and you're watching Medicircle. Today, we are here on our healthcare startup series with yet another new on startup entrepreneur. Today, we have Nikhil Bansal with us. He's the founder of FirstCure Health. FirstCure Health aims to simplify the surgery experiences by bringing the best surgeons with modern and safe procedures at affordable costs. Hi, Nikhil. Welcome to Medicircle.
Thank you so much, Smita. And thanks for having me on this series and giving me a chance to tell more about FirstCure.
So you're most welcome, Nikhil. Do let us know what is First Cure all about, because First Cure Health, I have seen the website. It clearly says that surgery is now made easier. Surgery is काफी आसान है. तो please brief us how and
Yeah.
what problems it is solving.
Yeah. So, Smita, this is about providing curative healthcare to the patients by bringing together some of the senior surgeons who are equipped with modern procedures and assisted care using modern methods to solve the patient's needs, and that too at a reasonable cost. So what we try to do is we want patients to just focus on their health, on getting better and leave everything else to us. We want to tell them that they are not alone. Right from finding the right doctor suited to their for their needs, finding the right hospital which is fully equipped with modern facilities, and that too at a reasonable cost, arranging all diagnostic tests which may be necessary, and providing post-consultation. We also provide all insurance paperwork, admission discharge facilities, and also take care of the of the patient transport at the admission time and at the time of discharge. So this is why we say that surgery is आसान है. We understand that the experience can be stressful for the family and for the patient.
As the saying says that best surgery is no surgery, but when there is a surgery required, definitely it needs to be done. So I think there are a lot of factors which goes into consideration when any patient is specifically looking or searching for the right healthcare partner for their planned medical treatments or surgeries. There can be
Mhm.
cost issues, there can be affordability can be one factor, infrastructure can be other factor, the doctor's experience also counts, availability, lot of parameters are there. So as you are hand holding the patient right from searching the right doctor and the right hospital to post-op free consultations, free follow-ups, which also First Health is assuring for the patient. So what are the prime USPs you have been targeting?
So the main USP is again, we ensure that our doctors have a minimal post qualification experience, and they are equipped with the most modern methods. Our doctors are at least 10 have at least 10 plus years of experience, and we want to institutionalize this in a way that this is the first year doctor. First year has said that this is the doctor I should go to for my treatment. So the patient, we want to reach a stage where patient trusts first your doctor, because our screening criteria is so stringent. We handpick doctors. So one, the patient can be rest assured by the doctor's ability and experience. Second, our hospitals are mostly mid to small sized hospitals, but they are boutique hospitals which are fully equipped with modern equipment and facilities. They have ICU, they have emergencies, they have everything needed to take care of any last minute issues, or any emergency situation. So our hospitals, none of our hospitals lack in any of the requirement that a patient may have for his treatment and any ancillary conditions related to it. Uh, like affordability again, since we buy things in bulk, we buy the material used in surgeries in bulk, we buy the infrastructure from hospitals in bulk, we are able to pass on a part of the savings to the patients. So this is another key benefit that we offer to our patients. And we are, and that's where we are also pocket friendly. Our packages are designed to cater every need. So our team has been trained in a way that's not let any patient go unserviced, and we make it possible to provide them services. For example, for HIV positive patients, especially, they find it a lot. They find a lot of difficulty in finding the hospitals who can treat them because it takes specially trained staff to handle them, to handle their needs and special facilities. And they're not able to find those hospitals who can actually provide them unless they go to a corporate chain of hospitals. So when we realized this problem, we created a network of hospitals and doctors who were trained or equipped to handle such cases.
True, but there are a lot of patients also which were not opting for elective surgeries in the COVID era. But as per study, there are like elective surgeries are going back, coming. I mean, they are back to 80% of the pre-COVID levels. Like one of the hospital chains in India, Fortis Healthcare, which is the largest integrated healthcare network, is witnessing close to 70% occupancies across all its centers for all the planned medical treatments that used to happen. So, like, how has the COVID scenario, as the patient volume is going up for the elective procedures? So, did you find any slump earlier, and what is the patient behavior now post COVID?
Okay, so that's an easy one for me because I did not face this challenge of COVID on my business because we started only after the third wave. We were setting operations in January when the last wave came. And since then, so in February and March, we were setting up, we had done a soft start. So in some cases, some 10 or 20% of the patients were concerned about COVID safety and all, but it doesn't seem to be a concern anymore. And besides our hospitals, all of our hospitals follow COVID protocols. They are COVID safe.
Yes, that's good.
So that
And
is also one of the things that we assure our patients of.
one question on your funding, though, as you have recently raised funds. So, how was this round, and how has the funds been utilized?
Yeah, it was a pre-seed round of about 350K uh, through private placement. We plan to, strengthen our operations in NCR and Bhopal. We are investing in an app. We want to be a holistic provider of services, not just providing curative healthcare, but also, helping them remain fit. But like we run, free programs for yoga and some Zumba classes and some diet plans. So this is what we are going to introduce and make it a little more holistic. And we want to spend on marketing and reaching out to and tell more and more people about what we can offer to them. The next is in geography terms, our next plan is to go to Bangalore and Hyderabad. And in the north, we were looking at Chandigarh and a couple of cities in Uttar Pradesh.
Tell us something about your revenue. So, how much you have raised? I mean, how much were your revenues in FY 2022, and what exactly, and especially you're planning to close at this year, FY 2023? Because so these centers which you're planning to open, I mean, Hyderabad or Bangalore, they would be operational by this year end, or you're planning for the next?
Yeah. So FY22, we had just set up operations. We actually started generating revenue by end of March, early April. So for FY23, as the growth that we are seeing coupled with our expansion plans and we are targeting to cross about $1 million in terms of the revenue, in terms of our billing.
And anything you would like to share with the fellow entrepreneurs who are watching this healthcare startup series today at Medicircle?
Yes, I would like to share what I truly believe in, that set the foundations right, set the processes right, hire the right people. I strongly believe that the first 20, 30 people will define the culture of the company, and the first processes or fundamental basic processes of the company will help it grow and sustain that growth. It's easy to have hyper growth by burning money, but to sustain it, you may want to invest a little more time uh, finding the right people and setting up the right processes, even if it takes a little longer to start growing at a fast pace.
So that's great, and thank you so much, Nikhil, for joining us today at our healthcare startup series. We wish you and FirstCure Health all the best, so that you can reach more and more patients and surgeries बिल्कुल ही आसान हो सके, because if surgery has to be done, definitely it comes with a lot of stress and pressure. And in this, if a startup like FirstCure is helping you out through that entire journey, that's really good, because we definitely need such kind of people who would be taking us through, because there are a lot of paperwork, then there is insurance policies and things like that. There are a lot of times we need to decide which hospital to go, which doctor to choose for that particular treatment, and that's very important. As far as the surgery is concerned, equally important is where you are going to get that surgery done. So to keep your information, get good information, choose your doctor and the right healthcare provider for all your planned surgeries, and keep watching Medicircle for all such healthcare news, and also in news from interesting startups, how their innovative products and offerings are changing the way we used to look at healthcare 2 years or 3 years back. Thank you once again, Nikhil, for joining us today.
Thank you so much, Spencer. Thanks for having me.